Hello, my name is Najima Akaji. I'm a mental health nurse practitioner in NKU. I'm going to describe my most interesting patient for the week. The patient is a 64 years old female patient, a good historian with history of polysubstance dependency, bipolar disorder, chronic PTSD, and major depressive disorder. Patients report that she came to the clinic because she was referred to the clinic by a therapy due to the long history of polysubstance use disorder and recent tremor since she was placed on Abilify 10 milligram PO every night for a month. The presenter and I evaluated the patient to rule out evidence of extrapyramidal side effect. Upon evaluation, tremor was noted. The patient denied body ache, auditory and visual listener, denied suicide and homicidal ideation, and no evidence of tardive dyskinesia and lip smacking observed. The patient reported long history of substance use disorder and stress that she's been using drugs since she was 10 years old. And she reported that her first drug was LSD. The preceptor utilized layman language to verify the reason why the client started using drugs early in life by saying, "How long have you been smoking dope and shooting up?" The patient replied that she's been using meth back and forth for nearly 45 years and stressed that she's ready to quit and make a change in her life because she's not feeling good recently. The preceptor and I asked her to explain what prompted her to drug so early in life. She said her closest girlfriend at the time, who passed away 3 months ago from a drug overdose, was the one that informed her that drugs such as weed and amphetamine will enable her to think faster, quicker, and she'll be able to get her homework done faster than the rest of the class. As a result of this, she says she started smoking weed, using meth, and drinking alcohol after school hour. The preceptor encouraged the patient to quit smoking and stop using drugs to promote her well-being. Preceptor advised the patient to continue taking Abilify 10 milligram at bedtime for depression, gabapentin 200 milligram 2 times daily for neuropathy. Patient was started on Bospa 5 milligram for mild anxiety, 2 milligram congentin 2 milligram 2 times daily to prevent any adverse effects that may arise from antipsychotic medication. Patient agreed to treatment plan and she said she will comply to treatment and medication regimen. The client case is of interest because the patient admitted that early exposure to drug and alcohol abuse in early life contributed to her mental illness and she's ready to make a change to be a better person. Interestingly, the patient had a few tattoos on her neck and upper arm with inscription of each drug she was known for at the time. In today's visit, the patient says she has enrolled in a yoga class to stay active and she wants to see if the yoga will help her quit drug entirely because she has been going back and forth to rehab and sobriety facility for nearly 30 years and nothing has been changed. Prescriber encouraged the patient to quit smoking and to avoid using drugs to promote her recovery. Patient says she's ready to make a change because her granddaughter is about to have a new baby and she wants to be a grandmother with a positive testimony. What I learned from this week clinical was that as a provider, we should try to learn few common language that can be used to evaluate the patient with substance abuse. Using those familiar language will enable them to reveal their feelings properly to the provider. We must also utilize active listening, silence, and empathy when dealing with this patient to promote clinician and patient rapport. Thank you.